Greetings, everybody. Welcome to Therapist Take, and we're going to talk about our new therapist worth it, so don't go anywhere. Hello, everybody. Welcome to this live recording of Therapist Take. I give the same spiel at the beginning of every episode. So we're going to do some housekeeping things real quickly before we start talking about our new therapist worth it. So just remember that these episodes are recorded live. So if you're listening to this on the podcast, which I would encourage you to go check out the podcast and follow us on the podcast and review our podcast and also check out the show notes of the podcast, because we do try to put a lot of resources in those show notes for people to have more than just what we're, the words that you're hearing right now. So, but if you're watching this live on YouTube or on Facebook, follow us there. Hit the subscribe button on YouTube and make sure you ring the little bell so that you can be notified when we go live or when we post other content. So anyways, we're going to talk about our new therapist worth it. But first, I've been scrambling around trying to get all this set up, and I forgot to say hi to Carrie, like I always do. So hi, Carrie.
Hello, Josh. I know. Good. We just jump into working.
We just jump right in
each other
into everything, right? And so, but I'm going to introduce our guest. Dr. Kelly Roberts is with us today, and she is someone who's very meaningful to us. We've known you for a good part of 2 decades, I'm sure. Mm-hmm. But one of the things I remember the most is that before we even started our practice, when I went into private practice just a smidge before Carrie did, you served as a consultant for me. We met several times and went over this is how this is how you would do it, basically, and that was 15, 16 years ago or something like that. And so you've been in the picture a long time. But Dr. Roberts is currently serving as the director of the Marriage and Family Therapy program at Oklahoma Christian University, which is also my alma mater. And she is the chair of the Human Sciences program there as well. And she has a resume that is way too long even list. She has done so many cool things. I wish we should just do a Kelly Roberts podcast.
We could just listing the things she's done, right?
Yeah. If you want to take your list, take it. Do that.
Oh, I think you're like one of those Renaissance interesting people, you know? Yeah.
But on that, I think we're okay on that front. Yeah. But welcome. Thank you for being here today, because I know you're very busy. So
thank you.
For
I'm so glad to be here. So good morning to you and to you, Carrie.
We just started chit and chatting too.
I love the greeting piece that you guys did. That made me feel all warm inside. So
good.
Thanks.
Yeah.
It is. It's like we get to relax during this a little bit. Mm. So doing this is kind of therapeutic in a way too.
Yeah,
so
perhaps for us.
We get to breathe a little bit and do some EMDR on each other. And we're good. Yeah.
It'd be hard to do bilateral stuff with the microphone.
I know.
Yeah. Exactly.
Yeah.
Exactly. So we brought you in specifically for this episode because of your unique role, basically being responsible for training new therapists. Mm-hmm. And, we all used to be new therapists. Mm-hmm. And that does seem like ages ago, but in some ways it doesn't seem like that long ago either at the same time. Mm-hmm. But then it seems like forever ago too. And so we're gonna dive into a few different things. Excuse me. So real quickly, let me just kind of let everybody know who's listening or watching what we're gonna get into. We're going to talk about, first of all, who are the new therapists? Who are these newbies? Mm-hmm. We're talking about how do we identify them, and does the adage of you pay what you get,
you get what you pay for,
or you get what you pay for, you get what you pay for, or is less more, or more is less. Did I get them both backwards?
Well, I think they go either way.
Okay.
Right?
Kind of which one applies when it comes to new therapists. And I think it might surprise you, the answer. And then just kind of talking about the differences in what someone's experience might be when we when they have a new therapist versus a seasoned therapist. And we might have to define what a seasoned therapist is too. I don't know if there is a middle. Like, is there a middle? I don't know.
I don't
We'll have to
know.
dive into
Yeah.
that. But that's what we're going to talk about. But before we dive into all that, do you guys remember? Do you guys have any? Do you remember what it was like being a new therapist? Like, do you remember that first moment in clinic, or like?
I do. Carrie,
Yeah.
I see you smiling. We all have our
Yeah,
memories.
we do.
I was just thinking as you were talking, Josh, that I had imposter syndrome before they actually had the term imposter syndrome. And I was like,
You were the
I finally
first.
found myself. You know,
Kelly
that's
was-
what it was.
That's
Of
what
course,
it was.
Kelly's the first imposter.
Of course, Kelly's the first
She's done
imposter.
everything
Yeah,
first.
I know.
Before it was all.
Yes.
But that term
Yes.
really lands now,
Yes.
especially when I see, all the therapists that are going through the pipeline now. But Carrie, what was your first memory of?
Yeah. Oh, I remember opening my mouth to speak, thinking, "Whose voice is that?
That's great.
That doesn't sound like me. Is that me?
Yeah.
Right? Oh my gosh, this is
Yeah.
me. Yeah.
Carrie just can't get past her. Kelly's over there thinking, like, why are people listening to me? And
Yeah.
Carrie's like, is that even me talking?
That's what I mean. Like, it's such an imposter, right? Woo, who is that? Yeah.
Well, let me ask you, did you sound good?
I don't know. I think I was so preoccupied with everything else. I don't know.
Were you impressed with that voice?
I know. I know.
Yeah, I'll remember. I'll never forget the first time in observation. So people who aren't aware of how we're trained, it's different based upon where you're going. But
Sure.
In a lot of marriage and family therapy programs, they have their own clinics on campus. Some of them don't, but I know Oklahoma Christian has one too, and it's a beautiful clinic, and with some great technology. And there's often an observation room, so where there's a one-way mirror, and the non-therapist, like when you first start, are watching the new therapists do their thing. And I remember sitting back there, I think it was Eric Archer, I was watching Eric, and I was just like, how does he do that? I was like, it was just mesmerizing watching how easy he just kind of, how his conversation flowed, and you could see his wheels turning, but it didn't deter him from his flow, and I just was so impressed by that, and I was thinking, like, I'll never be able to do that.
Yeah. I remember that too.
I do too. I remember going into that observation room, Josh, with all of these constructs. Don't be loud, make sure and give the good viewing spots to the ones that are ahead of you. Don't speak, these kinds of things where we really had a lot of constraints just to be within the privilege of experiencing confidential information. It felt awe-inspiring in some ways, but then to find yourself on the other side of that mirror was terrifying. And I get tickled because when you guys were talking about your first experience, everyone's different, but we were put into co-therapy teams at first. And so my teammate and I were both very competitive and like in sports and in grades. And so what happened in the therapy room? Well, we were just fighting for the airspace, I think. And so the poor client was sitting there probably watching this tennis match between us. And when we watched ourselves back, I was mortified. I mean, I was mortified. We're going, what are we doing? This is so bad. But seeing yourself in a different way, like as an observer, it's a crazy experience.
It is.
It's just hard.
It is for someone who doesn't like criticism to have to sit in front of your professors that you want to please and impress, the colleagues that you're now your blood brothers and sisters because of what you've gone through, the people above you that you think are gods, right? The ones below you that you don't want to scare away. There's no way to run from that feeling of everyone can see what I'm doing, and I got to take the feedback, and then I got to watch myself, and then I got to hear that voice again. And it is intense. And I did co-therapy with Eric. That was my first case.
Was he your first one?
And he was smooth, and except for when he'd get up, his armpits were soaking wet.
He's nervous.
Internally, he was like churning.
Yeah.
And I told him, I think I said something like, thank God. Like, you seem calm. I'm glad to know you were nervous too.
Yeah, no, hidden. Yeah, that normalizes it to some degree.
Yeah.
Right. Do you guys? Do you ever get nervous anymore?
I think sometimes I pay attention to the content of the intake versus the theory that I know. And if I ever get a little distracted by that, I do still feel butterflies. I'm 60 years old and I still sometimes feel butterflies until you settle in and you realize you've got this, you got the skills. But I think, I don't know why it is the words on the paper that sometimes scare me a little bit when this humanity is just this is their version of humanity, you know, and so maybe that's mine. What about you?
Yeah.
I think I don't think I really recognized it. I'm sure I did to some degree based on what case we're dealing with, or you know how difficult the case is versus how you know we're rocking and rolling with it. But when we did EMDR training and I did my first EMDR session, just making myself do it, you know, just going like I just got to do it, you know. And I think what's intimidating about it is you know that this is a very powerful form of treatment, you know, and you're playing with someone's brain here, you know. And so it's just like, you know, I'm just gonna you know, have to trust, as Carrie always says, you know, trusting that our clinical skills should be the thing that we rely on that allows us to do some of these new forms of treatment, that we are skilled and equipped to do it. But yeah, I was really nervous starting out.
It was a similar time travel experience to take EMDR and then, I have to do new things, right? I mean, I was nervous about it as well. And when our trainer, Kara, said, the only way you learn to do this is by doing this.
And did you remember feeling, and you know Kara Nickham too, right?
Actually, my second-year students are with her today.
Oh,
really?
wow. That's right.
They're starting their EMDR experience, and I was thinking they're all having a brand new experience again with a new model, you know, and the butterflies come.
Their brain is going to be full.
Oh, they're going to be they're going to be so amazing though. I'm so glad you're doing that.
I know.
But it's we all know each other, obviously.
Yeah.
All these therapists. We need to get Kara on the show.
I know, we'll have to bring Kara too. Yeah.
But it was weird because I remember feeling like Kara was like Dave to us, like Dave being our nurturing professor of old, you know, who was always so kind and sweet and gentle and nurtured us along. And then I felt like, you know, Kara was our new Dave. And I'm like, I don't know, I'm not way older than Kara, but I think I'm older than she is. And then she gave it too. I mean, she was our Dave Fournier in that EMDR session. So it was a kind of it was the time travel experience for sure.
It was.
Yeah.
I know.
But I will say this, as much as we're about to start talking about it, kind of dispel some ideas that people might have about new therapists and maybe help put some of their fears and anxiety at ease, but I would never go back. I don't want to do it again.
Yeah. Yeah.
And that's not because I wasn't equipped. I think it's because of the life-changing process it is for the therapist to go through this.
It is.
You know, in learning to be a therapist. A lot of people probably don't realize that they're basically getting 2.5 years of some highly intensive therapy themselves vicariously through the training.
Absolutely. With every case they see, there may be something that touches them in their own experience. With every journal article, it's almost like your own psychoeducation. You're learning about yourself as much as what you do, as much as your clients. It's 3 or more levels every single time.
Yes, absolutely. I wouldn't go back either. And I even think that it compounds the older I get and the longer I live. I realize even more about how revealing and shaping that graduate program was, you know, and how much I just had no idea. You know, someone asked me, how'd you decide to do this? I'm like, well, I really liked it, so I just went and signed up. Oh, Carrie, you have no idea. You're going in one way and coming out a completely different.
Yeah.
You know, that training ground is a reference point. It's as if you restarted some part of your life or deconstructed, reconstructed. And in that point, you will always have that reference point. And it's always a place and space to go back to and for ways to say, I don't want to go back. I will never be the same. It was immeasurably positive for me. I changed. I'm not the same person. There's a lot going on.
There's a lot going on. Yeah.
So I think it's easy to identify when we start as newbies, as we say, as we have said. But when do you guys think you're not a newbie anymore? Like, what's the cutoff? What's the threshold there?
I think for me, it comes in different ways. And so I don't know how you guys experience this, but when I have had more than a handful of cases that are within a certain realm of presentation, certain dynamics, or certain presenting problems, and where I feel like I've got a data set now, and I'm grabbing from all of those cases and then relating it to some, at least, of what's going on with this next case, because I did research in every single one of those cases, and they all informed the next one. That for me is a hub of experience. And so I feel like I can grab and have grabbed over the course of my career hubs of experience. And so there are some populations I still might even feel new in, depending on how that goes. But I feel like I have multiple hubs of experience, and that's soothing to me, and I feel comforted in that.
Yeah.
I think that's true.
Yeah, and the reason I think this is an important question is because when somebody's looking for a therapist, they're gonna look at credentials, and they're gonna judge books by their covers. So like particularly your youth, and so like if you're really young looking, then they're thinking inexperienced, right? And then they're looking at this person, what does it mean to be a candidate? What is this? Just says clinical intern, or and so like on the surface, it looks like people are newbies, quote unquote, until they get licensed, at least. And I don't think that's necessarily the case, because I didn't feel green until I got licensed. I felt like I knew what I was doing for the most part, like within reason, right? Like not in an arrogant way, but just felt like I was very equipped and well trained, and still had a lot to learn. But I wasn't afraid to. I felt like I could work with people, and there's some I couldn't.
Yeah.
And so for people that are listening to this, or they're looking for a therapist, I think that's an important piece to recognize, because it's just kind of like one of the things that I tell my kids, like when I'm like, "Hey, I'm proud of you," but then I say, "But are you proud of yourself?" Because how you feel about you is way more important than how I feel about you. And I think that's also true for the therapist, like that how we're feeling inside as therapists is going to reflect on the work that we do. And I'm not saying all therapists come out or do that, and I'm sure the process is different for everybody, but I think hearing your therapist, meeting them, and recognizing that just because they don't have just because they have the candidate behind their name, or they don't have the credentials that you're thinking, does not mean they're not going to do effective work.
Absolutely. So. I agree with that. And I think a lot of that has to do too with the quality of your training. Right. And so when you come out with what you're describing, and I felt similarly, I've got enough kind of a strong base, right, that I don't have to know how to do, this specific play therapy model, but I know how to do play therapy, right? Enough to figure some stuff out. And so I do think it depends. I mean, there are levels that people may not know about how this works. You go to graduate school, you get a certain number of hours there, right? Then you get to go typically off-site and get clinical hours there. Then you have to pass exams, right, after you graduate. Then you can go petition to become a candidate for licensure and earn hours. And then after enough hours and supervision, you become a licensed clinician. So there's a lot of hoops, right, to jump through that offer some definition, I think, of where are you in this process? How seasoned are you, right? But that doesn't always mean, like you're saying, like I've got my L after my name, my license, that you are or are not, green or, oh, yeah, I got this all figured out.
Yeah.
Yeah, and I think sometimes our culture, and I'm trying to decide, do I do this too? while I'm even talking about it, but our culture many times looks at behavioral health providers slightly differently with their selection criteria than perhaps a medical provider.
Sure.
Because we don't say to a medical provider, if you're not an alcoholic and you haven't gotten through that,
Yes.
I don't want to come to you as an alcoholic.
Absolutely.
But they do when they think about their own mental well-being.
They do.
And many times they'll say, are you a parent? Well, I
Yes.
don't want to come to you for parenting if you're not a parent.
Right.
And so there are these credentialing, pieces that then you have to, as a new therapist, push through and be almost extra
Yes.
confident in yourself because you have to not only be there with that patient, but be there through the challenge that the very first criteria they're laying down.
Yeah.
And sometimes that speaks to some people's greatest fears. Like they're telling me I'm not ready, and my fear is I'm not ready. And so if you can push through that, good for you.
I
You
know. Yeah. Oh, I remember that.
Right.
Yeah,
Yeah.
those screening questions. That's what it felt like, right?
So one of the things that I think happens or is assumed sometimes, and it's probably correctly assumed in a lot of cases is that the adage, you get what you pay for.
Yeah.
That's probably true in a lot of ways, or we probably wouldn't have the adage. But I don't think that's the case with mental health. I think if you look at our fee scale, our candidates, for example, aren't charging as much as the licensed people, but that's mainly because of the standard that's kind of set, so I think that the other adage that, say it for me, Carrie, the less is more. Is that right? I get them mixed up when I'm put on the spot.
When you're put on the spot, you can say it both ways.
Is that right? Less is more. Yeah, less is more. So that I think that's more applicable here. Is that these people that are seemingly very green are actually doing really effective work. And I have my theories on that, but I know, Kelly, you brought some actual real data with you.
I did. I was a little worried about quoting old data. I was telling Carrie and Josh when we were getting ready for this that you remember these data that we used to be quoted for, and I think the faculty were just trying to, hand us a little bit of confidence here. Data show that new therapists are actually more effective sometimes than seasoned or licensed therapists, probably because of their supervisor. And then, there's kind of a joke and like a bada bing with that, but also it was real data. But I was worried about it being old data, and so I did a little bit of research. Now, this isn't brand new. It's a huge 2012 study, but 2012 is okay, know. And it showed that in a very common model, which if you have read anything about behavioral health, you've usually seen CBT, cognitive behavioral therapy. And so it's frequently used as one of the training models. It's used across the United States in a lot of ways. But so they were testing this particular model, but they were with student, graduate therapists in training. And the scores with that group of therapists in training, this was no small model. No small research study. There were 500 and some odd students in this study over time. So it was long. There were lots and lots of students. And over time, every time, they scored higher by 2 or 3 or 4 points on the outcomes of the goals, even than the seasoned and licensed therapists. And as they were writing the results, they alluded to the system of support. It could have included just the students helping each other be prepared, or those supervisors, or just being really fresh in your mind about, the nuances and maybe the new pieces of the modality. But the data show over and over, both in the training we had and just a decade ago of this huge study, that they're as effective or even sometimes a little bit higher. Yeah.
So there you go.
Good.
There we go.
Yeah. I mean, I agree.
Yeah.
And I'm sure in the study they might talk about why, but I'm going to give my take on that is because this is called Therapist Take.
That's
so
right.
I'm going to give my take
Your take
on this, okay?
That's what you get,
So they're inundated with this. Remember how it was? I just brought the systems theory book for Kelly to take back. I mean, I should pick the. I'm going to get it.
Okay. Yeah. Sorry, I put stuff on it.
Look how big this thing is.
That's one class.
This is one class, you
The
know.
thing's got to be like 6 pounds.
Yeah. And systems theory is the theory that marriage family therapists are trained under. But and when I gave it to Kelly, she was like, "Oh my gosh!" Like,
I'll never forget
like
the
I
party
handed her a
of putting
gold
it
bar
together.
or
Yeah,
something.
it is treasure. It has this like very mystical value.
but man, this is one course,
Mm-hmm.
and we got how many more binders of different courses that look just like this,
Yeah.
you know, and so especially the students, the one who are in these training programs like the one that Kelly's running. It's every day. I mean, they're not going home and doing a side hustle somewhere, or I mean, maybe some of them are, but a lot of them are going back home and they're studying, or they're meeting with their professors or the other clinicians, and they're talking about cases and. They're constantly thinking about you, their clients, and trying to work through these, the unique problems that everybody brings to the table. And so I think that's one of the main reasons why they're really, even though they might not know what to do right there in that moment with this client, where someone like us might be a little more comfortable with going certain directions and kind of letting our personality show and things like that. They might not do that as much, but they're going back to their supervisors, and it's just every day, and it's all they're thinking about is therapy. So,
Yeah.
So anyway,
And I think even in one of the things about being a clinical intern is that you are having individual supervision, one-on-one every week. You're having supervision with your group, your cohort every week. You're writing papers where you have to pick a spotlight case. So you are getting so many hours of work behind your experience with that clinical intern, right? And then the clinical intern, because of their group supervision and their individual supervision, are also getting self-work, right? Evaluating, what did I do? What was this about? How does this fit? How does it not fit? And so I just think it's like a power punch, right? Lots and lots of effort and energy is packed into maybe just, what looks like just a few sessions, right? With a client and a rookie therapist.
Yeah.
It really is. When you walk into a session, especially if you're at a training clinic and you're working with a graduate level therapist in training, we practice that little phrase right there.
Okay, yeah.
But you are possibly getting 3 or more hours of research, dialogue, supervision, and thought just for that 50 minutes that you spend with them, and or more, because a lot of times we dwell on cases, even when we're driving or when we're thinking, walking down the sidewalk and thinking, oh, I didn't think about this, but it's a constant work in progress. You're right.
Yeah. So anybody that's listening to this or watching this, like, and you're nervous about starting with a new therapist, I think even some of the therapists that aren't as highly trained in their newness, which I'll explain what I mean in just a second. I think that you can still take some comfort in taking a chance on them, because they are getting a lot of supervision, and they're studying a lot, they're thinking a lot about their cases. And so I just think that, it may not work out, but how many times have you gone to a seasoned therapist and it didn't work out?
Yeah. Sure.
And you're like, this person is not a good,
not a good fit.
And how many do we know, or that we've heard of or know, that we're like, I don't know if I would refer to that, but how did they become a therapist? It's like, so there are definitely some seasoned therapists out there that are, you might have some of the same experience with. So,
yeah.
And what I meant by what I was saying, like the difference in training is, and I wanted to address this a little bit, just because different programs train their therapists differently. So, like, we all went to Oklahoma State University. It's a highly reputable program at the time. I still think it is. And before I stepped foot in an off-campus site where we go and we do more training somewhere other than our clinic on campus, we have like 100 hours of therapy under our belt. Some people won't see a single client until they get that off-campus placement. So, but even with those therapists, they're still inundated with this stuff, So no, they might not be as seasoned. I don't know if there's such thing as a
Experienced.
seasoned newbie, but they might not have the experience that some of the people that coming out of programs that have on-site clinics, like Oklahoma Christian has one too. But they're just getting so much supervision and a lot of data and studying and things like that. So
Yeah.
Yeah, we call the training clinics labs or other kinds of words that really it is just a petri dish, almost of what you're cooking in there. And the next level of readiness would be when they go out to an external placement, like working with you guys right here at this clinic. And so one of the things that we do in our program, and I'm sure they do in a lot of other, rigorous programs, is they cannot be released for their external placement until they have achieved the level of at least readiness on the clinical factors and the outcomes and the measures that we look at for clinical skills. And so they don't get to start until they're there. And it's tough sometimes. It's tough, especially when you watch some of your other colleagues get ready a little earlier than you do. But their readiness is readiness, and there's a huge inventory of what that means. And so they've received a lot of scrutiny and a lot of dialogue and observation before they get there. So, yeah.
right.
Yeah.
Well, let me just mention that for people who aren't aware of this, and to be honest with you, until I went to grad school, I didn't really know campus clinics were a thing.
Yeah.
And so if you're not aware, a lot of these colleges that train therapists have clinics on site that often have very affordable rates, and you would get to work with, see a therapist in training. And Kelly, can you tell us just a little bit about what might be different from the experience versus if they came here and saw a quote-unquote seasoned therapist?
Sure. I do think that there's a difference in the feel and the experience of privacy. Even though our ethics are just ironclad, confidentiality is confidentiality. But many times, if they came to Family Solutions, that confidentiality, the borders around that would be them and you. That's it, and so maybe you staff a case, but you've said, or they've agreed to, that you can have these consultation kinds of conversations. But the feel and the look and even the way it's shaped, confidentiality is just a little different because it's for you and all of the students. And so we do have that ironclad shield, but it's for a much bigger space because it's a learning space. We may take a video from a session and slice it down to 30-second pieces, 5-minute pieces. We may put them into presentations where we're proving we've reached a goal. We may look at something that we can't figure out over and over because every minute of video is data. And so in some ways, you're almost agreeing to help teach.
Yeah.
Yes, I'm getting these services. Yes, there is an expectation that they're good quality services. And they do have all of this supervision around it. But also, I agree, because I'm paying a lower reduced rate, to help you learn.
Yeah.
And I think it's an altruistic thing.
I do too.
I do have sometimes the clients will say, I realize what this is. It's a training clinic, and I'm kind of like that. They almost come there because they want to give back and also receive. So there are definitely gives and takes with that environment.
Yeah, I just want to be clear on something too, because I think one word that you that I honed in on when you were talking was you said when you're talking about confidentiality, you're really talking about the feel of confidentiality. Because and I'm sure that you run a tight ship over there, but as kind of how we were at our training clinic too, confidentiality is an extremely important thing that is preached over and over and over to us. And so it's that feel of, because I know you guys might have a couple of rooms that are one-way mirrors, but you guys are mainly using the video technology now, right? And of course, we have the one-way mirrors. I think getting rid of the one-way mirrors might actually help with that, make people feel less like they're being watched. Even though they know they're being watched, it's just that feel of being watched. but knowing that they're being recorded, those recordings are being played,
Right.
everything. These are just other means of consulting
Yeah.
There
with
are.
each other. And it just feels a little less private. So my encouragement for people would be to just talk to the therapist about it. I mean, sometimes we would even, as people would want to see the observation room, they'd want to see the other
Yes.
therapist.
Yeah.
And we would
Sure.
let them do that, because anything to help you realize that these types of things are happening anyways. Even among seasoned therapists, we are consulting. You know, we highly value a team approach here, and so we're constantly teaming up and trying to figure out the best ways to help. We're not putting anybody on video,
Right.
you know, but that's just maybe we should. We might do a better job if we did.
Yeah.
Well, I will say it's definitely the highest level evidence-based gold standard of a training. And it's not just for behavioral health
Right,
clinicians, it's
sure.
also for medical doctors. I just installed exactly the same system that I have in my training clinic into the Chickasaw Nation residency program. There's cameras in every single room. They turn them off. If there was any ever disrobing or those kinds of things, but that kind of training allows for so much more intensive learning
Yeah.
and refinement of treatment and of practice. And it's a lovely thing, but you do have to think of it, I think, in a different way when you step into the environment.
Yeah.
Yeah, I do think that, just an observation about this, that as technology becomes something that we're just more comfortable with, I think in general the population is more open to that than even when we were there. Because we would have to put, or when we'd go off site for recordings, you have to get out the old fashioned video cameras and all that kind of stuff, right? But now that phones and video and all that is always accessible, I think people feel a level of comfort with it that is a little bit different. I'm not saying that talking about the most personal details of your life and knowing a classroom will be watching is easy peasy, but I think it's a little bit more maybe just kind of, I don't know, experience or normal in some ways.
It is normalized, I do believe. When we were in the program, I remember us gearing up to persuade or at least,
Yes.
educate our patients on why the camera,
Right.
and what that meant,
Yes.
or the two-way mirror. And I would say after watching a full year, we just finished a full year, over 350 clients coming through over this
Wow.
year, then we've only had 2. One of them just really struggled with paranoia. And the other person, their story was just so traumatized that they couldn't even get started with the cameras on. And 2 of those times, of course, we're going to honor that.
Sure.
We're going to honor
Sure.
the individual that walks in. But
Yeah.
out of 350,
Yeah.
only
2.
2?
Yeah.
That's not
Yeah.
many.
That's not.
Yeah.
Right.
Yeah. So, I think also living in the world of social media, I know a lot of people, there are a lot of cons to that, no doubt.
Yeah.
But there are also a lot of pros to that. And, one thing that I really like is the OCMFT Instagram page. So I don't know, I guess you guys are probably assigning each student to have like a week or a month where it's their job to post. And it's a way for people to see
Yeah.
what these grown men and women, by the way, these aren't children.
Right.
Okay.
Right.
They're grown men and women, what they have to offer. And so if we can, we'll make sure we put the OCMFT
Yes.
Instagram on
Yeah.
the screen, but can you tell do you remember the handle for that?
It's at OCMFT.
Oh,
That's
Real
very
simple.
easy.
Nice.
Yeah.
what about the clinic URL, the website?
Okay, so if you were just in a search engine and you wanted to Google, we try to name things what they are. So our training clinic is called the Family Therapy Clinic. I mean, it's that easy. So, and you guys are naming what you are, your Family Solutions, right? And so we are the Family Therapy Clinic, but if you put Oklahoma and Christian on there, it'll pop up. The website is very easy. Everything if our university is oc.edu, and then it's usually / whatever it is. So it's our / Family Therapy Clinic. And
Okay.
so you can find it very
Yeah.
easily, and or
think
you
there's
can
some
go to our
hyphens in
Instagram. Yeah. There's, Family - Therapy - Clinic.
Clinic, yeah.
There
Yep.
you go.
Yep.
Nice, Josh. I'm glad you remembered it.
Good remembering the dashes.
Yeah, I know. Very
Thank
good.
you. You know, I mean,
He's
I
our
just wanna be useful
marketing
for something.
technology guy, so it's good to know.
You want to send, trust me, like you don't want to send somebody to the wrong website. You never know what the
No.
non-dash version will take you to.
Yeah, family therapy. Who knows? Oh
So,
man,
anyways, well, man, we could talk forever.
Forever.
I know,
Yeah, I know.
forever.
And it's been great having you here. Thank you for coming and talking to us about this stuff. And maybe, hopefully, we've dispelled some myths and maybe we've eased some fears
Sure.
for some people that are
Hope so.
thinking about utilizing a candidate or someone who's in training at a clinic at some college campus somewhere. So,
Hope so. I know.
One of the things that I always say, both to my therapist and I would say to everyone who's listening here, just ask and say, you're new. How can I feel good and trust, that what's going on? And the therapists that have gotten through and can serve you well will be able to answer that question.
That's a great one. Yeah.
I think it's only appropriate for me to finish with a newbie story.
Awesome.
Oh, good, Josh.
think-
Yeah.
And it's and I know for a fact that this circulated for a few years amongst Oklahoma State University MFT students for a while because when I would tell the story, oh, you're the guy.
Oh,
So,
okay.
Of course, very nervous. Do you remember when we do the depression screenings?
Yeah.
So this was something that we did to kind of get our feet wet,
Yep.
and it wasn't therapy. It's just kind of bringing people in and doing an assessment and kind of just giving them some feedback and making some suggestions in terms of, maybe you should get help, basically.
Yeah, sure.
And so I think it was the very first one I was doing it, and I was nervous. And the guy scored off the charts, which I didn't know at that time could mean a false positive, right? Like that there might be some error there, And but I'm like, oh no, like like my very first experience. I'm with somebody who really needs some help, and I'm having major imposter syndrome, and they may have needed some real help. So I'm not dispelling that, but so when after I read the assessment and I go in, I'm very clearly nervous and I can't get my words, and I'm, long pauses and stuff like that, and finally. This guy sitting across from me that supposedly is very depressed, at least seemingly on paper, looks at me and he goes, "Hey man, are you okay?" And I was like, and there was a sense of like, I appreciated him asking.
Thanks. Yeah.
So he took care of me for a minute. And so I was just like, I think I said something to the effect of, I'm fine. I think I just told him the truth. I'm just, I'm really nervous. and when you said you should ask, that's what triggered that memory. Was like this guy like basically saying, we're not going to do therapy for a second.
Right.
I'm going to make sure that you're okay.
Yeah. Can you do this, man? Yeah.
And so that story was told for a few years, I think. So it still might be. I don't know.
Maybe it
But
makes
I'm
people
that
feel
guy.
good, right?
Yeah, it happens.
It happens.
And you know what I love about that story though? He didn't just get up and walk out and I know that can happen sometimes,
Sure.
but it's like I think a lot of people have grace toward people that are learning.
Yeah.
And so
You do.
Yeah.
yeah.
Well, thanks for sharing and helping
Thank
me
you.
laugh a little bit too, right? We could all share some of those, right?
Yeah.
We could go around and have
I think Kelly's happy to let me do the sharing. on
Yeah,
these things.
100%. I'm not. Did you hear me go? And mine is no.
No, but I can see you logging this away for that time that you were going to bring it up. I mean, like, remember when you did this?
Oh, yeah.
I
Not
never
in a
did
mean way, just in a little brother kind of way.
Yeah, that's right.
Yeah.
Maybe that's another podcast, is just stories.
We should do that.
Yeah.
Just
Yeah.
therapist
The
stories.
audience of only the people. who've
I
been
get
through
real
it.
nervous. When we talk about nerves, I get real nervous talking about them because I'm like, I don't want to even. This has been 20 years. About 20 years ago. I don't want to break his confidentiality.
I know.
So
right.
I'm really thinking about
Yeah.
what I'm saying and how I'm saying it,
Yeah.
because I don't want, like, what if he's watching?
Right. Yeah.
What if he
Yeah.
remembers, hey, I remember that guy?
Yeah, right. You were nervous.
Yeah. Yeah, and I think that care and concern is something that we do all have from newbie to now.
Oh.
You know?
Yeah.
And
Yeah.
so I appreciate
Yeah,
that.
we're not newbies anymore.
Yeah.
I don't think
You
so.
still have care and concern.
Yeah.
Yeah.
That's right. Well, thanks, Kelly.
Yeah,
I appreciate
thanks,
you being here.
Kelly.
And thank you, everybody, for watching or listening.